thrilled to have you with us. Conviva and CenterWell Senior Primary Care, we embrace the achievements of our time in integrating AI into technology, into our healthcare practices. Tonight, we'll share insights on current initiatives and our visions for a future of medicine with AI tools. We're also eager to hear questions and thoughts during our QA session. I am Jason Tagg, the Senior Physician Recruiter for Miami-Dade, Broward, and Daytona areas, representing Conviva and CenterWell Senior Primary Care. I also have some coworkers that are here to help me. Valerie Myers, Senior Physician Recruiter and Sorcerer Extraordinaire for Florida. And I also have Kathy Lynn Petrucco, who is going to be the recruiter for El Paso, Jacksonville, and Palm counties. They are both going to be in our chat rooms today and answer any questions that might come up. Before we dive in, there's a couple of housekeeping rules. During the presentation, all participants will be muted to ensure clear communication. We'll be having a question and answer session at the end, and feel free to jump in and talk or to send out a question inside the chat. Valerie and Kathy Lynn are on hand to provide any answers or send up the question to us to answer for it. If you prefer, we can save your questions at the end, and we can answer them that way as well. So let's get the show on the road. I am pleased to introduce two esteemed members of the Conviva team, Dr. Shanaz Kazi. She's an Associate Medical Director for our Tampa market, and Dr. Ashley DeBay, who is a physician lead at our Okeechobee Clinic, which I can never say properly. Thank you both for joining us this evening. Dr. Kazi, I'm going to start with you. Please share us a little bit about your professional background and what really brought you to Conviva.
Hi there. Hi, Jason. Hello, everyone. Thank you so much for having me. Thank you, everyone. Oh, sorry. Can you hear me?
I can.
Okay. Okay. Thank you, everyone, for joining. I really appreciate you having me. My name is Shanaz Kazi. I'm the Associate Medical Director for the Conviva Tampa market. I did my medical school at the University of Chicago. I did family medicine residency at the University of New Mexico in Albuquerque. I came to the Tampa area to practice in 2015, so about 10 years ago. And I came to Conviva as the medical director in June of 2023. And prior to that, I had actually been searching for a new opportunity for about 2 years. I really took my time. I looked at a lot of different opportunities. Early on, I took great pride in being a family medicine trained physician, in being trained to do full spectrum, all ages family medicine. And I really wanted to do that for my practice. But what I found after several years was that was really a volume-based world, and I wasn't able to give patients the attention and focus on disease management and preventing things, and focusing on preventive care and screenings and keeping people healthy. So when I came across Conviva, I feel like I found what I was looking for. My passion is really empowering physicians to deliver exceptional quality patient care. And I found that with Conviva, I'm able to do that. So I love it so far. I guess we're going on 1.5 years, and it's been a great experience so far.
I love it. Dr. DeBay, same for you. What is your professional background and what brought you to Conviva?
Well, hi, I'm Dr. Ashley DeBay, as he had mentioned, physician lead here at Conviva for a lot of St. Lucie and the Okeechobee office in West Palm Beach. My background, actually, I went to med school in West Virginia, School of Osteopathic Medicine. At that point, residency, then I was in internal medicine here in Florida in West Palm Beach. So I'm well known to a lot of the different specialists and docs in the community. After residency, I had originally thought my heart and passion was in hospital medicine. So I practiced for many years in the hospital, working at different various hospitals around, but it just wasn't conducive to having little kids running around and not really sleeping much. Not to mention the patients that I would meet in the hospital. It's kind of get in, get out, and you don't really get to develop the relationships that I yearn for. So coming to Conviva or finding out about Conviva, I was really looking for more of a well-established company that can provide a bunch of different services that can help with my patients and my patient care to give them the best quality care that I can give them. I researched a lot. There's smaller companies that really don't provide as much quality services as Conviva did. So it was a no-brainer for me to jump right in.
And I love no-brainers. That's amazing. Dr. Kathy, let's start with you. Tell us a little bit about the basics of what AI is going to be doing and how it's going to be integrated into our daily operations.
Sure. So there's two main clinical programs using AI to help support our providers. And there's one that we're further along that we'll probably be talking a little bit more about today. That is the use of a software program to help with dictation. So the providers can use that in the room with the patients to capture all the information. The AI software generates a note that the provider can then use to document the visit. And I think we'll let Dr. DeBay talk a little bit more about the specifics of that. And then there's another newer pilot program that is just barely getting started. And that will use another software program to help mine the patient charts for all of the most up-to-date preventive screenings to help pull that information into the charts for Medicare annual wellness visits. So we are a senior-focused primary care company. The majority of our patients are on Medicare. And so one of our big things is doing that Medicare annual wellness visit every year and making sure that we're reviewing all of their preventive screenings. So the goal of this new bot is to help support the providers by pulling all that information in so that the providers don't have to work on all that chart mining.
That is so cool. So it's doing admin work in the background?
Yep. Yeah. Mm-hmm.
That is nice. Okay, cool. Dr. Dubé, do you want to add anything to the great basics of the AI?
So the AI opportunity that we're given here, the specific software is called a bridge. And it was presented in a way that, allows you to have more contact, face-to-face contact with your patients and, allow you to be able to not have that computer at your face as much and have more quality visits. So we were really excited to be able to experiment with it for sure.
So on a very basic level, is it just that you're sitting inside of a room with your patient and talking, and the AI portion of the program is going to relay all that information into one form? I mean, I don't understand how that works.
Yeah, so it's actually very exciting. They initially put an app on your phone, and there's an app on your computer as well. And as you're going into the room, obviously you get patient consent. And from there, once you do it, you press start on the app after you text the name of, not text, but you type the name of the patient. And then you just carry on a conversation, after that, it generates on the computer. You can either choose a more elaborate version of it where it literally goes into detail, or you can do more concise to the point. So it gives you a bunch of different options to change kind of how you like your note, and it continues to evolve.
Nice. So it's basically taking over like a scribe almost.
Oh yeah, 100%. And you can train that scribe as the AI, which I found extremely interesting. It wasn't just a one size fits all. You can literally go through the settings and set it exactly as you want it. And, even having conversations with some of the Abridge representatives, they're always looking for feedback to then, kind of further aid us in making it more personalized.
Nice. So what's your first impression then so far? Like, what's the impressions you're seeing? How is it making your patients' visits easier, your documentation, your charting, that type of stuff?
So my entire through hospital, through outpatient care, I have been using Dragon. So my first thought process is, well, how does this compare to Dragon? Does it make life easier or worse? Now, I happen to talk very fast, so Dragon is very quick for me. But there are days where I am loaded up with patients, and of those patients, they're very long-winded at times with multiple comorbidities and multiple issues. And sometimes it can be a little mentally draining. So the first time I used the Abridge was very exciting. I knew I had a rough day coming ahead of me, and I went into the room and prayed it would work. And at the end of the day, because I knew I wasn't going to be able to chart anything other than just get the basic meds and orders in, I quickly opened up the app on my computer, and I was astounded by the amount of information it was collecting. And even when you had multiple people in the room, somehow it was able to differentiate between the two people talking. So I had couples in the room, and they were able to get out the conversation because, husband and wife talking back and forth, or whether it's daughter and mother. But it was able to differentiate who was talking and make the note so concise. I have found that, when I use Dragon as a comparison, I may forget certain details because if they're on, complaint number 10 or 11 or what have you, and I try to concise it as much as possible, but sometimes you forget the smaller things. But AI allows you to almost kind of
give me an example of one of the smaller things that you might forget.
Oh, so, somebody coming in with, I have headaches, trigger finger, I stubbed my toe the other day, and it keeps going on and on and on. You want to hit on the bigger diagnoses with that, and maybe you forget the trigger finger, maybe you forget the I stubbed my toe because there's no active bruising, no signs of fracture or what have you, but it's still going to list it in the note. And what I like about that is when the patient comes back and it's like, remember when I told you I stubbed my toe? And then I don't have it in my note, but AI will have it all in there, that keeps track of it for you. The other thing I noticed too, I have some patients that kind of not really talk in order. So they'll start on one subject and then they start going back to 10 years from now, and then come back to the present time, then go 3 years from now or in the past. And I was really worried about that specific patient, and it organized all of those thoughts for me. So it was unremarkable in that essence.
So it recognized the difference between an ailment that might have been happening now compared to something that he might have talked about in the past.
Mm-hmm. Absolutely.
That is so cool. Okay, perfect. Dr. Kathy, as far as your region, I know that you have multiple doctors working directly for you. How are they seeing it better inside Tampa market?
Yeah, so my doctors are in love with it. I think they would agree with everything Dr. DeBay has said. It's pretty impressive how effective and accurate the software is at capturing an appropriate visit note, despite or even in the setting of a lot happening in the visit. And so, as Dr. DeBay said, one of the advantages is that instead of like staring at the computer, you can actually look at the patient and have a conversation with them and look them in the eye. And especially for our patient population, that's a big thing that they value. The other thing is, a lot of our patients like to talk. They like to tell us about all sorts of things. They like to talk about their dogs, and that's a big favorite. And it's amazing that the software is able to differentiate between what is medical medically relevant and what doesn't need to be captured in the note. So it will recognize, oh, I tripped over my dog and fell and hit my hip and, and had this injury. It will recognize the difference between that and just a patient just telling me about how much they love their dog and all their adventures with their dog. And it leaves that out of the note and just pulls what is medically relevant. It's remarkably complete. And I agree with Dr. DeBay that sometimes there are just little things that you don't really focus on in the visit because it's just not a priority. Patients have lots of things going on. And so sometimes it is helpful at the end to kind of have the note that the abridge has generated as like your checklist to make sure that you've had the opportunity to enter all the orders and everything that you discussed with the patient. So that's another way that I've seen my physicians use it. And again, a lot of us are very efficient with Dragon, but it's amazing how much more efficient you can be with a bridge. I have, a physician who's able to see a very heavy patient load, help with drawing blood when they're understaffed with MAs, and then he'll still call me at 4:30 just to chat and say hi and tell me how busy his day was, but all of his notes are already done and he's ready to leave at 5. That's not every day, but that's pretty amazing when you think about how much time it can take to do some of the charting.
Dr. Causey,
that sounds amazing.
Sorry to interrupt, Jason. There's a question here specifically that says, is this AI tool able to support languages other than English?
Yeah, I saw that. And yes, that is another capability. So again, you don't even have to specify anything. You don't have to enter any settings, but it recognizes several languages. I actually don't know how many, but definitely in our region, Spanish is a big one, and it will recognize and automatically translate into English for your charting.
Oh my goodness, that's so cool. That sounds amazing.
Before we switch off,
Dr. DeBay. Oh, okay, go ahead.
We received a couple other questions since we're on the topic of how it formulates these notes. So the first one is this info just going in the subjective area of the note, or can it populate it elsewhere in the chart that's created?
I can answer that. So most of that information, it really can go everywhere. However, it's not fully integrated into ECW at this time. So, when you're doing your physical exam, it's going to write it in almost like a paragraph form. And then the treatment, it'll do that. So you have to do a lot of copying and pasting, which is kind of, cumbersome, but they are looking at ways, especially with our upcoming transition to maybe a new EMR, on how to fully incorporate it to make it even better.
Wonderful. And then the other question is, what about when a patient points to a body part and says it hurts here, or it, is kind of physically describing something? What do you do with those situations?
Yeah, so I can also answer that too, because it took a lot of training on my end, especially when it comes to, and we can even go into the physical exam later, but when a patient did that, while I was using AI, it hurts here. So then I would reiterate, it hurts on your left knee, so you would almost have to talk through it, which is sometimes a little foreign for people, but once you start practicing with it a lot with the physical exam. So once you're done with your HPI, I would say to the AI, okay, now I'm going to move to the physical exam. And at that point, during the physical exam, you say, okay, this is what your heart sounds like. This is what your lungs sound like. And you keep going on and on. You almost have to talk through the entire exam. But you really can actually say what they're pointing to as far as the provider goes, and it would catch it.
I think even sounding out each thing you need to do while you're doing it could be a benefit to the patient because they understand what you're actually doing to the patient.
To an extent, when it comes to the physical exam, what I found is sometimes it made people a little nervous when I was talking about regular rate and rhythm, saying all the things that, no murmurs, no clicks, no gallops. They're like, what is all, am I supposed to have those things? So it does get a little weird when you're doing the physical exam part.
And fair enough. That goes into our next question then. And that would be, what challenges have you encountered? We've already heard about a couple using AI in that clinical setting.
I think I can start, Dr. Kazi, if you don't mind. What I have found, specifically, I use it a lot, obviously, mostly for my HPI right now. And sometimes, a little bit as reminders of what I wanted to put in my treatment. But with regards to the HPI, there's certain things that, I like to personally start my HPI with. For example, patient here for 3-month follow-up.
HPI?
HPI, history of present illness. So basically, what is the patient coming in for?
Okay.
And that's the subjective part that you're talking back and forth with the patient. So I typically like to start my HPI, with patient coming in for a 3-month follow-up on, and then I list the diagnoses that we're talking about. So diabetes, hypertension, hyperlipidemia, and then I go on to talk about each individual thing. With AI, I found that it's more of the conversation and it lacks that beginning part of the sentence that I think a lot of the auditors are looking for as well. So that part I always had to kind of edit and change. And then, like I said, I'm very proficient in Dragon. So, by me talking really fast, I was trying to differentiate, which is faster. Is it my Dragon, or is it me reading through this paragraph and editing it to my liking? I'm a little OCD. So some people just take what they get with the AI, but I like to make it sound more like me and add my little personal touches. So, in that aspect, it kind of was at a default, along with obviously not being fully integrated into our EMR with having the full physical exam and the treatment and what have you. Because even with the treatment, they're looking for stable, unstable, worsening, things like that. It doesn't necessarily do that unless you speak it directly every time, which again can be a little cumbersome when you're in the room with the patient.
So I think with the current...
Excellent. And
I was just going to respond to some of that and address some of it along with some of the questions in the chat. So our current EMR, we use eClinicalWorks, and we are changing to Athena throughout this year. We'll be rolling into Athena one market at a time by the end of the year. And part of, not the only, but part of the reason for that transition is that the AI software is more integrated with Athena. So instead of having to do all that copying and pasting that Dr. DeBay was mentioning, it will just be more integrated into the program. So it should be even, even more seamless. One other interesting thing about the software is that you can, if you're a person who chart preps, you can go in and start the program before you actually go in to see the patient. So if you're the kind of person that you want to like run through a whole bunch of things, look at some labs and put that in there, you can just speak into the program before you even go in with the patient, and then go in with the patient and pick it up, and it will pull all that stuff into your note.
What's an example of something like that?
Patient has diabetes. Last diabetic eye exam was 8 months ago. A1C is 7.3, on metformin and Farxiga, whatever you think like you want to make sure that you have as part of your note, so that you don't.
And you would speak that out kind of like you would with Dragon?
Yep. Mm-hmm. Yeah.
Absolutely.
Yeah. And then I think one of your questions is what are some of what are some of the challenges? I think another challenge that I've seen with some of my providers is having the discussion with the patient and getting the patient on board with using the program. So one thing that doesn't work is to say, hey, I'm going to be using this program to record our conversation today. That generally causes panic in patients. And while the software does listen to the conversation and it does generate temporary recording for the purposes of creating that transcript that you use as a note, that as soon as you finish your note and you mark it as complete, that recording disappears. So you're not actually like creating a recording that has longevity in the system. So just helping patients to understand what you're using the program for, hey, Mrs. Smith, I'm going to be using this app today to help make sure that everything we talk about gets into your chart today so that we don't miss anything. Then the patients generally are on board. But if you just say, oh, I'm going to record this conversation and leave it at that, then I think most patients are apprehensive about doing that.
I definitely have to agree with that. I had a lot of patients go, well, I'm scared to tell you this next thing because we're being recorded. I'm like, don't worry, I can edit it out if I
Oh
need
my
to.
goodness. So, and in that situation, if a patient is feeling a little bit uncomfortable, do you turn it off or do you just kind of talk them through it one more time?
So you don't even start it until you get, well, I start it to get the permission on there. But yeah, if they say, I really prefer not to use that, well then, yeah, you have to turn the device off and go back to the way that you normally did it.
Okay, fair enough, fair enough. So what advice would you give to those who are apprehensive about this whole thing? Because you talk about there's a little bit of cut and pasting going on. There might be a little bit of confusion with the patient. So what advice would you give?
Well, you never know if it's going to work for you until you try it, right? So if worst case scenario, yes, there's a lot of copying and pasting, but guess what? Copying and pasting is a lot quicker than having to either type it out sometimes. And also just to jog your memory of what you talked about. Sometimes you're sitting there thinking, I know there's something else that we spoke about. And I'm trying to remember, but by 12, 15, whatever patients that you've seen, sometimes everything becomes a blur. So, it has a lot of useful benefits. It's best to start practicing with these things now and getting comfortable with it because I think it's just going to continue to improve and it's going to continue to hopefully start taking over and making all of our lives a lot better.
Nice. And as far as Dr. Cassie, what words of encouragement would you have with anybody who is basically hesitant about any type of new technology, much less even AI?
Sure. So I think you got nothing to lose by trying it. I have several providers who are quote, new, young, into technology and have adapted very quickly. But I also have several providers who are very seasoned, who have been in practice for many more decades than I have, who started on paper charts, who've gone through, learning dragon dictation and now have fallen in love with using the software because it makes them so much more efficient. So you really don't know if it's going to work for you or help you until you try it. The other thing is that the learning curve for the provider using a bridge is pretty quick. It sounds pretty overwhelming at first, but I can teach one of my providers how to use it like literally in a minute or less. There's just not much to learn. It's literally log into the program, hit start, hit stop, it generates the note. That's all there is to it. There's just really not a lot of training that is needed in order to learn how to do it. So I feel like people there's not a lot to lose by trying it, but there's potentially a lot of time to be gained back into your life if it works for you.
I know that I use AI in things like writing emails and stuff like that for recruiting, setting up marketing ideas, things like that. And I know that in the future, it's going to be even faster, better. How do you see this integrating and getting even better for the future? Like, what's the next 5 years look like for AI, especially with Conviva directly? Either
I can answer that.
Dr.
Yeah.
Kazi or Dr. Conviva.
I mean, I can tell
Okay.
you what our hopes are, and I think what AI, the companies of AI that have different AI's hopes are. I mean, the hopes are we as providers lose all of that administration time of documenting and everything else, and we can walk into a room and just have a conversation, come up with a plan, and not have to be bogged down by having to do hours and hours of charting at the end of the day. I mean, honestly, I believe that's what leads to a lot of physician burnout, is not so much the conversation and the interaction with patients. That's why we're here. That's why we love our job. It's the other things that, having to chart every little thing and having to chart it a certain way. And so I do think the future will be walking into a room and being able to really pay full attention to your patients. And then at the end of the visit, 90% of your note completed before you can even have the patient leave the office.
I
That
agree
is
with
amazing.
Yeah, I agree with that. And I think what I'm told when we transition to Athena, so I haven't seen it at work yet, but what I'm told is over time, the software will be able to help with, if you say, okay, I'm going to order these labs for you. I'm going to order a CBC to check your hemoglobin. I'm going to order a CMP to check your creatinine. I'm going to order a TSH to check your thyroid. The programs all work together to generate those orders so that at the end of the visit, all you have to do is kind of scan through, make sure everything was accurate and sign off on it, and everything is already done. So you don't have to sit there and spend all that time trying to make sure that you're entering all the orders, entering all the codes. Again, as Dr. DeBay said, the hope is that you can go into that room with that patient, look the patient in the eyes throughout their visit, and everything is done by the time they leave. The orders are in, the note is done. And yes, you probably have to take a look at it for accuracy and maybe do a few edits, but for the most part, things are done. So I think we're close to that. I think we will be in the next couple of years and hopefully in the next 5 years.
So
What you just
doctors,
said there just brought a question up.
go ahead, Jason. Go ahead.
I'm sorry, Catherine. I just had one question when she was just mentioning. You mentioned that referrals and for follow-on things like that. Does it automatically start trying to find a referral, for instance, or any type of, if you have a medication, does it automatically send the prescription to the pharmacy? Has it gotten that smart yet?
So not yet, but that is where we're definitely headed. And I think probably sooner rather than later. And that's supposed to be one of the perks of when we switch over EMRs. It's supposed to be a lot more integrated in that way so that you can just say to the system, hey, let's, refill that levothyroxine to your Walmart on, 62nd Street. And again, maybe you have to double check the dose and the accuracy and everything and click a button, but it should be able to load all that up for you so that it cuts down on the number of clicks that the provider has to do to make that happen.
Yeah, the
That
question I was going to
is
call out
amazing.
from the chat, thank you, doctors. Linda here asked, per HEDIS screenings, are they auto-populated, allowing you to address dates completed? Thank you.
Yes, so that is not currently part of what the Abridge software is capable of. But earlier when I mentioned that other pilot, the newer pilot with a bot, that is one of the things that other software or that other system is going to be doing, is pulling in HEDIS screenings, pulling in all preventive care things. So all of the components of a preventive care plan that are required for a Medicare annual wellness visit, a patient's vaccines, their colon cancer screening, their mammograms, diabetic eye exams, all those things. The goal is that this other system will be able to pull all those components in to start generating that part of the note for a Medicare annual wellness visit.
Nice. Okay, before we transition, I think this is a good time to transition and be able to open it up to the folks in the chat and ask even more questions. But before we do that, I just want to highlight a couple things about our organization. Currently, we are active in 15 states with over 338 clinics. That's as of the mid-December. We are opening new locations throughout 2025, including North Carolina, Texas, Louisiana, Florida, Virginia, Kentucky, Indiana, and Nevada centers. Let's open up now to our questions and see if there's anybody in the chat that would like to come off a chat and just ask directly or send it through the chat lines.
There was I think we've addressed a few of these. One of the questions is, are there any other AI features that, that you're aware of when you switch to Athena, or that, we're looking towards integrating in the next, years or coming up?
I know that you mentioned the chat bot. Can we go a little bit deeper into that and what that's about?
Yeah.
You talking about the bot that I was mentioning for the preventive screenings? That's really the only thing. Yeah, that's the only other thing that I'm aware of is, that will pull it in. I guess maybe some of the other things that I think are probably coming are helping patients to fill out pre-visit paperwork. So I'm not saying that we have anything going on with that right now, but I think that is something that will be coming to help with the registration process and getting new patients integrated. I can see that as being another thing that happens in the future.
You mean they wouldn't have to write their name 15 times on 15 different forms?
Maybe. Maybe.
Nice. I like it.
Dr. DeBay, you mentioned that your biggest comparison was Dragon, and there was a question there in terms of accuracy, in terms of straight dictation, or, how you feel it compares there and what you might, like better or, is different.
So, it's really going to depend on the provider, to be honest. With Dragon, I'm incredibly efficient, right? So I can talk fast and I go through an HPI in a matter of seconds because I know exactly what I'm going to say. But there are providers out there that kind of drag a little bit on Dragon, no pun intended. But they take their time to try to formulate their thoughts in the paragraph. So in that essence, I think they would be a lot better at the AI. For me, having to kind of read through the paragraph and tailor it the way that I wanted it, sometimes can be cumbersome. But like I said, it's a great checklist for the things that we spoke about that I can then utilize in my Dragon to get it over. So I did notice it saved a lot of time there trying to remember exactly what we talked about if I didn't already chart it on my notepad. So as far as the answer for that, it really depends on the provider and how efficient you are with the comparison to Dragon. If it's a lot slower for you to really think about your shortcuts and things like that, because some people use Dragon at the bare minimum and some people know how to utilize it so you can get things done quickly. For those that are kind of not as technology inclined with the Dragon, I agree with Dr. Kazi. AI for a bridge is really easy. I mean, I've showed it to a couple of my providers that aren't as good with technology, and they were very surprised how easy it was. So it saved them a bunch of time.
And can you remind us, like what form it comes in? Did you say it was on the phone or on the computer? Like,
yeah.
If you can access.
Yeah, so that's actually kind of what I wanted to address. So initially, when we were doing the abridge, you had to have your computer there with you with the app open, and you have to have your phone there with the app open that they sent to the phone. And then through the phone, like Dr. Kazi said, you would have a start button, and at the end of the conversation, then you press stops before you go into the next room. The biggest complaint that some of the providers, my providers I had is I have to carry my mouse, I have to carry my computer, I have to carry now 2 different phones because I have my personal phone and my work phone because they put it, on my work phone. So they are currently, if they haven't already, integrating it just into the computer. So you have just your computer that you would bring in with you. For me particularly, I have a laptop that I bring in from room to room. So it's becoming less cumbersome. But if you do have it on your phone, because I saw one of the questions in the chat is, can you bring it on a mobile device? Absolutely. You can bring just your mobile device in the room as long as you don't have to review any documents and things like that. And it'll capture everything for you on your computer as long as you have it open in your office.
How far away do you have to be for it to actually listen and start picking up stuff? Like, could it be on the one side of the room where it's not really bothering the patient, where the computer's right in front, or does it need to be fairly close?
I mean, so I always had my phone near me and the patient was on the other side of the room and was able to pick up fine. It would be equivalent to putting your phone on speakerphone when, and as we all know, we'll call patients, spouses or caregivers and put them on the phone and they can hear us just fine. I mean, the exam rooms are not like a mile long. They should be able to hear it no problem, just like they would on a
Sure.
speakerphone.
Okay, perfect. I like it. I like it. Any other questions out there? Looks like we had some basic ones like what EMR system and stuff like that, but anything else that is being wondered by the crowd?
We've gotten through the chat questions that were there.
I actually have
Well, perfect. Well, perfect. Oh, okay.
Hello, can you hear me?
Yes.
I can.
I don't mean to be too repetitive, but my question up top was really more simply comparing dictation accuracy. I'm not talking about efficiency. If you wanted to dictate a letter word for word yourself, is this as accurate as Dragon?
As far as getting the words correct.
And the grammar and the spelling.
Yeah. Actually, I was trying to describe something on AI, and it gave me the medical terminology for it as if, I would normally say it. So as I'm talking to the patient, and I'm like, any radiation of pain down your leg, and they say yes, and the AI said, patient complaints of lumbar radiculopathy, things like that. And I'm like, oh wow, this is really nice. So it actually it's more than accurate. It does pick up everything. There was only maybe 10% that I found to be not correct. But of majority of my notes, there was very little I had to fix from that standpoint.
All right, thanks.
Mm-hmm.
Any other questions? Well, this has been fantastic. Thank you very much for everyone's showing up today and listening about how we are integrating AI into our Conviva CenterWell world. Thank you so much for coming out, and I look forward to everyone joining Conviva today. I have some jobs open. Come on down. If there's not any other questions, thank you very much. It was great for everyone to be out today.
Thank you.